Order. Call the meeting to order. This is the Standing Committee on Community Services. I am Susan Corcoran-Greek, MLA for Lunenburg and Chair of this committee. Today we will hear from presenters regarding reducing financial barriers for children and families. I would remind everyone while checking my own phone to make sure that the sound is turned off. Please put them on silent. And in the case of an emergency, please use the Granville Street exit and walk up to the Grand Parade as our marshalling point. Hopefully that won't be necessary. I will now ask committee members to please introduce themselves for the record by stating their name and constituency, and we'll begin with MLA Stoylov.
Hi everybody, my name is Damian Stoylov and I'm the MLA for Bedford South.
Morning everyone, my name is Diane Timmins. I am the MLA for Victoria the Lakes.
Good morning, it's a pleasure to be here. Thanks for coming. My name is Kyle McQuarrie and I'm the MLA for Inverness.
Ian Rankin, Timberley Prospect.
Lena Hamid, Fairview Clayton Park. Good morning, everyone. Susie Hanson, MLA for Halifax Needham.
Thank you all. I would also like to note the presence of Legislative Counsel Aaron Fowler and our Legislative Committee Clerk, Tamber Nusaba. I'm going to get that right sooner or later. So again, the topic today is reducing financial barriers for children and families. I welcome our witnesses, and I would ask you to please introduce yourselves, and perhaps we'll begin on my far left, please.
Hi, good morning, everyone. My name is Frazer Egerton. I am the Executive Director of Strategic Operations and Innovation for Opportunities and Social Development.
Good morning, everyone. Craig Beaton, the Deputy Minister at the Department of Opportunities and Social Development.
Good morning. My name is Tracy Embrett, and I'm the Executive Director of Child and Family Wellbeing with Opportunities and Social Development.
Good morning. My name is Nicole Hazlehurst. I'm a Project Director with the Department of Opportunities and Social Development.
Thank you very much for being here, and importantly, thank you for all the work of government is very important, but in particular, the work that is captured within your department addresses some of our most vulnerable and is very important work. Who will be providing? Okay, Deputy Beaton, if you'd like to begin with opening comments, please.
Thanks very much, and good morning, and thank you for the opportunity to be here. The topic for today's appearance is reducing financial barriers for children and families. It's certainly an important time to have this discussion, and affordability is a key issue in communities across the province. Government recognizes that and has taken a holistic approach to addressing affordability and reducing financial barriers for families. At Opportunities in Social Development, we work with our colleagues across government with a focus on actionable solutions. And what that does is it allows us to not only leverage only programs and services from across government, but also insights and the resources to create solutions that meet people's needs today. In recent months, we've seen actions on affordability in various forms: lower taxes, higher minimum wage, historic investments in housing, a new school lunch program, and many more. In our department, you've seen actions in other ways. We've increased income assistance rates and indexed them to inflation. We've introduced a new disability supplement, which was $300 per month last year and is now $308 per month with indexing. We've invested in supportive housing for families, including the Rose in Halifax, which will have space for 24 families and children once it's complete. We've launched the PATH program, which provides up to 6 years of financial support and otherwise to young people leaving care and heading off into adulthood. And just yesterday, we announced increases in our individualized funding programs for disability support. That includes direct family support for children, which helps families caring for children with disabilities at home. Parents in that program will see an increase of up to $800 per month starting this month. That's just a small sample of work happening in the department and across government to make life more affordable for families and to connect children, youth, and families to the services and the support that they need. In the interest of time, I'll wrap it up there, and we look forward to your questions today. Thank you.
Thank you, Deputy Beaton. Are there other members who wish to make Okay, so we are going to move right into questions. I'll remind everyone to please wait until I have identified them and your mic light is active, so that we can ensure that comments are audible for the record and for any of those following along on the broadcast. We will start the first round of questions with the NDP Caucus under the new format, 20 minutes, followed by the Liberals for 10 minutes and the PC Caucus for 30 minutes. We'll then look at the time that remains, but probably wrapping up questions at about 11:40. So we will begin with questions from the NDP Caucus, and I would recognize MLA Hamid.
Thank you very much. Thank you guys very much for being here. Really appreciate it. Child poverty is an important topic, so let's go right into it. Can you clarify the reasoning why we're using, and I asked this at estimates, the market basket measure, why we use that measure as a measure of poverty in Nova Scotia?
Is there a particular member, or if a member of the witnesses can just signal so that I can recognize you? Okay, Frazer, Egerton, please.
Thank you very much for your question. So MBM is, first and foremost, it's the measure that the federal government has established, so it's official measure of poverty within Canada. It is also a very accurate measure of poverty. So as opposed to some other methods, what MBM does is it takes a look at, excuse me, what the actual cost of meeting your basic needs might be, and it does so in a particular area. So there is one measure within Halifax, there's another area within CBRM, there's another area in more rural areas. So it looks at how much you pay for rent on average, how much food is in there, how much transportation is, how much clothing is. And then it says for your household composition, so how many people are in your household, this is what is a rate below which you're unable to meet your basic needs, above which you can meet them. So it is a very accurate measure of what we understand poverty to be, which is, can you meet your most basic needs?
Thank you. MLA Hamid.
Thank you very much for that. The market basket measure, the federal government had started using it a few years ago. They were previously using the after-tax low-income measure, I believe. And if we're using that, which, you know, UNICEF, the Organization for Economic Cooperation and Development, and the European Union all use this measure because it's believed to be more accurate. So Nova Scotia's rate of child poverty would be significantly higher under this calculation, as 23.8 versus 14 under the market basket measure. Again, there are actually more accurate ways of measuring poverty out there, and so I ask if the Deputy Minister could answer with the rationale behind using the market basket measure versus other more accurate measures.
Deputy Beaton, please.
Sure. So I think, as Mr. Egerton has outlined, we use the market basket measure because it's the one that is currently federally accepted. So at this time, that's the measure that we currently use. I don't know if that answers your question directly, or if you had a follow-up question to that.
Emily Hamid.
So under even using the market basket measure, we've seen a drastic increase in the last 2 years in terms of from 2021 to 2022, a single year increase of 129.5 in poverty in Nova Scotia. This is the largest percentage increase in the country. So can the department outline what factors, or if the Deputy Minister, what factors do you believe had caused this rapid increase in child poverty?
Deputy Beaton.
Sure. Thanks for the question. I think the rise in the increase specifically, as you've indicated, dating back to 2001, I believe is the time frame you referenced. So we do know there was a dramatic drop-off of child poverty as a result of COVID and some of the additional federal rebates. I think of CERB as an example, which really dropped people out of kind of put them above the threshold for being considered in poverty. When those rebates ended, you've seen a dramatic spike back up in terms of individuals who would be below the threshold, and that would be one of the main contributing factors for why you've seen such a jump in the increase at that time.
Thank you. Emily Hamid.
For that, I appreciate it. So with the tariffs, potentially, or with the tariffs coming in, we know that there's going to be an increase in the cost of living for families. Does the department anticipate an increase, another maybe further increase in the rates of poverty due to this? If so, will there be any additional supports available for families?
Deputy Beaton.
Yeah, thanks for the question. I think the word tariff and the idea of tariffs is certainly something that I think has many of us worried, and certainly in this sector, many of our service providers and individuals that would be on income assistance, et cetera, are also potentially going to be impacted. I think we're at a wait-and-see approach right now. It's yet to be determined what the impacts are likely to be. However, I'm sure, as part of the budget process, we're all aware of the additional allocation that's been provided in terms of a contingency fund relating to supporting government interventions relating to impacts as a result of the tariffs. So, we'll continue to do our analysis and work with service providers. We'll engage with them and we'll get feedback. We have continuous feedback from our frontline service providers, not only, and also our staff and caseworkers who would work with individuals on a daily basis, doing proactive case management. So we'll hear from the front lines, and in preparation for that, we'll plan if needed, and we'll bring forward potential recommendations and solutions into government to ask if further investment is required as a result of the tariffs. But I think at this point, it's really too early to tell. So we're wait and see, like many other sectors.
Thank you. Emily Hamid.
Thank you very much. I appreciate that. I did want to just quickly jump into where, speaking about frontline workers, I've heard from several family resource centers about the home visits, not thriving families, the child parent journey program, that the funding that goes to the frontline workers, it has obviously certain requirements for the funding, one of them being that the pay for the staff that are giving these visits, we're so providing the service, is not really a living wage, and it's quite a bit lower than, as far as I've been told, quite a bit lower than government staff that would be doing the same work, and they had been anticipating an increase 3 years ago, and I think that during estimates I heard that there was an increase from 70 to 80,000. However, that didn't change how much they can pay the staff member giving the service, and so this is a question that is quite important to. Honestly, I guess all family resource centers, but the ones that I've spoken to are definitely concerned. So I'd love to hear a little bit more about, is there an increase? Because it was a priority last year, but they were told this year it's no longer a priority. So can just any sort of information around that would be great.
Deputy Beaton, please.
If you're okay, I can probably start on that, but if you want to get specific details about the family resource centers, I might kick it over to Ms. Embrett, if that's okay. But I think, in terms of the work, I know it was discussed a little bit during estimates debate, and, the family resource centers, I think, are from my experience and being out visiting a number of them, an exceptional resource for families in need. And you see, I've seen firsthand in a variety of fronts the work that they're able to do in supporting families, not only with food insecurity, but also with many of our newcomers. I think of the North Grove over in the north end of Dartmouth, which does exceptional work, and I think in the last year, the executive director told me they, taught over 4,000 families in terms of, I believe that was the number. I may have be misspoken on that, but it was a very high number for the amount of money that they're able to provide. So it's an exceptional resource. We have what are called multi-year service agreements, and we're moving into that in a more concerted effort. So working with individual organizations around what their needs are throughout the year. Staffing would be a component of that. And really, some of those decisions would be made at the organizational level about where best they would like to prioritize the funding that's provided. There was an increase this year, but I think if you want to get into more details, if you're okay, I can let Ms. Embrett expand a little bit further.
E.D. Embrett, would you like to add?
Is that on?
Yes,
Okay,
it is.
thank you. Oh, I didn't see the light there. Thank you. I would like to echo the deputy's statements about family resource centers being the foundation of child and family well-being, and certainly community, and that is where we want to see supports for families, individuals, youth start is in community, not with us. We would much prefer that. We've had significant budget increases, $11 million over a 3-year period. This year we will be doing some expansion to our youth outreach program that was planned. I've been to the Fairview Resource Center myself. They work incredibly hard and they are expanding. It is true that the Parenting Journey program, which is a parenting program that has an assigned support worker in community to work with a family that may have some maybe struggling or facing some challenges. So we fund it by program, not by individual, and there is an $80,000 annual funding for the program. So that's for the employee, that's for any expenses that go along with that. It is, there are different, we have family resource centers across the province, so there are differing approaches to how that funding is used, but we will continue to look at that. We have a close relationship with all of the family resource centers with reach-ins at any time. So I'm very open to having conversations if anyone is having difficulty.
Thank you. MLA Hamid.
Thank you very much for that. I really appreciate it. Yeah, the family resource centers, I said this at estimates, and I'll say it every chance I get. They have a special place in my heart. I'm gonna jump back into income assistance rates, if I could. So last year, the annual income assistance rate for a couple with 2 children was around $35,000 annually, but the official poverty line for a family of 4 in Halifax is $57,000. Why the gap?
Deputy Beaton.
So I think I would just, start off by saying income assistance as the social safety net for those that are finding themselves in difficult times. It's not meant to be a place where we would like people to be staying long term. So while the rates, are as you've outlined in terms of those 2 individuals, and we have various rates based on whether or not they're single family or if they have housing or not, the rates fluctuate. The key on it is that we have a number of additional programs that support in behind, whether it's things like rent supplements or rebates for heating assistance. There's a number of programs that we would have. And a key focus that we have in the department is really about trying to provide individuals with the ability to re-enter into the workforce. So a focus on training, a focus on education and skill development, I think would be the key. So the rates are not at what you would suggest in terms of the poverty line, but I think a number of other pieces go into determining the rates and how government is supporting to support families more broadly.
MLA Hamid.
Thank you very much for that. I think, there's an example of a situation that comes to mind where that's re-entering the workforce is not even an option, is a family or single mom, 3 kids, and they had they had moved here from abroad. The mom didn't speak very much English, didn't have the opportunity to go and learn it because of restrictions on who can take those classes based on immigration status, and therefore, the kids went to school, but then the eldest child had to drop off to go and get a job because the money they were getting was not sufficient, and this is including the fact that one of the children lives with disability, and so they get extra funding for that. And so this is a situation where, the mom did not have the option to be in the workforce, and then therefore a child had to stop getting an education to provide for the family because the rates aren't enough. And so while I appreciate, we definitely do want to see people, with good paying jobs. There's also folks who are not able to do that. And so, again, there are folks who are not able to be in the workforce, and the additional programming is just not cutting it. So is there any increases coming up? Because I know that I'm sure you hear this all the time. So, is there any sort of, any increases or changes coming up that could support families that are in this type of situation?
Deputy Beaton.
Thanks very much. And obviously, we do hear, various stories, and certainly empathize with the situation of that individual that you speak of, which is why I think, the implications of increasing income assistance, we did do a small adjustment in the last year where it increased by 2.5%. I know that's not a huge increase, but it does. Every dollar counts when you're a recipient of social benefits. I think indexing income assistance will certainly help because it's going to tie it to inflation. So therefore, it has a big impact on the earning power or the dollar spend of each individual based on the rates that they're currently receiving. But equally, I think I talked previously, I know that not everybody is able to enter the workforce, which is why we've implemented, the $300 disability supplement, which is now $308. And I can tell you that, from the caseworker feedback that we've had, and, I think of one individual specifically that I met with in Antigonish who was a caseworker for 28 years, and they talked about that being the single biggest increase that they've seen for their clients, and that affects over 12,000 Nova Scotians that are on income assistance who may not have the ability to work. We have some other really great stories, a very similar family to the one that you've outlined, where it was a single mother of three. The three children went through a program which we have, which is called Career Rising. And that program provides tuition supports for dependents of those that are on income assistance. All three of those individuals graduated from post-secondary education, and they broke the generational cycle. But also, they were inspiring enough to have their mother, who was working, looking after them as children, actually go back to school, and now she is moving off of income assistance. So, I think there is some really positive stories out there, and our caseworkers do an exceptional job of not only providing the supports that they can, but also the day-to-day case management. They take a very proactive case management approach, and where there are opportunities to support individuals, whether it's with additional supports like that, or targeting them into employment or other benefits, they certainly are there for them.
Thank you. MLA Hamid with about a little over 2 minutes just for your consideration in this time.
Thank you. I will actually ask a question about the special needs support. So, as Deputy Minister mentioned, there are a number of areas where income assistance recipients can apply for special needs assistance, including childcare. And this might be a question for Tracy. Embrett, can you share how many applications were received last year for childcare, and how much was spent on that?
Deputy Beaton, or
yeah, thanks. So I'll take that because it would be part of our ESIA program, and not Tracy would be the executive director for CFW. That being said, I actually don't have those statistics. I have statistics on rates and other things that I could give you today, but I don't have that. But you know what? We will take it away, and we're happy to provide it back to the committee.
Thank you. MLA Hamid.
Thank you. So the affordable living tax credit hasn't been, it's indexed to inflation, but the actual rate hasn't been increased. I don't know if we're going to get a chance to get an answer for this question. But can the department explain why the actual rate hasn't gone up aside from the inflation?
With less time than we get in QP, I would give the floor to Deputy Beaton.
So the affordable living tax credit is actually administered by Department of Finance. So I would have to leave it to them to give you a specific answer. Yeah.
MLA Hamid, with 20 seconds.
Thank you very much for your time. I appreciate it.
Thank you. I think we will move on now to questions from the Liberal Party. I would recognize the Honourable Ian Rankin.
Thank you, Madam Chair. And just following with the discussion around income assistance, because it really is the core program on how we help those that need it the most in the province. And I note that the comments that MLA Hamid said around the $35,000 not being enough for families. It is indexed. However, if we are comparatively on the low side, which is my question, we'll never catch up to a wage that I think is acceptable for people to live off of, regardless of their circumstances. And I understand that we don't want people on income assistance permanently, and I don't think anyone would advocate for that. But presumably when you're going into budgets and you're looking at requesting through Treasury Board any increases, you would have a picture of how we look across the country. And so I just want to ask the question, how does Nova Scotia compare right now with other provinces in the country in terms of what we give for income assistance?
Deputy Beaton, please.
Thank you. So we actually just had some recent jurisdictional work done on this very question, but we focused on Atlantic Canada. So I can talk a little bit about how we fare out relating to Atlantic Canada, and there are some differences. In terms of the general income assistance rates, and again, I think I had referenced earlier, there's rates for just essentials. There's a basic rate, and there's a rate for families. Relative to New Brunswick, if I wanted to look dollar for dollar in terms of the rates, we're actually, I should say, New Brunswick and Newfoundland, our rates are marginally higher. We're lower than Prince Edward Island, but Prince Edward Island doesn't have a Nova Scotia child benefit. So when you factor in those, we didn't actually do the analysis to sort of see how if you factor in the child benefit, where it all sits. But in terms of rate for rate, relative to New Brunswick and Newfoundland, our rates are slightly higher. I can give you the exact numbers. I just have to look at it in the binder.
But after.
Okay.
Yeah.
Sure.
Thank you, MLA Rankin.
Thank you, Madam Chair. And yeah, just tabling that would be helpful. So given that we are discussing the benefits of having a number of programs that fill the gaps, it's not just income assistance, why aren't we, or maybe we are, indexing those programs that you're mentioning in terms of having the child benefit, in terms of heating assistance rebate programs and the basket of programs, if the intention is to ensure that everything is being attached to the cost of living, and our strength is that if we're comparing to other jurisdictions that we have a host of programs, are we indexing those to make sure that we are keeping up with the cost increases that the most vulnerable are facing?
Deputy Beaton.
Yeah, thanks for the question. In terms of some of the other programs, I think one of the things that I had referenced in my opening comments was around it's really affordability is a government response. I mean, OSD certainly has a role to play in that in terms of the supporting those that find themselves in a difficult situation or in hard times, some of the society's most vulnerable. But broader than that, affordability affects all Nova Scotians. So, when we look at some of the initiatives that government has underway in terms of reduction of the HST, which will take effect today, that's a $500 million announcement that they had made during government. We have, increasing income tax thresholds, the school lunch program, which hopefully we'll have an opportunity to talk about because our department did play a role in that with Department of Education. There's a number of pieces that kind of fall into how we affect and support affordability. In terms of indexing, your direct question around indexing some of those programs, I think we have conversations with our government colleagues around how we address broader affordability for Nova Scotians, and we play a role in that. But in terms of indexing particular programs, those would be things that I wouldn't say that we would necessarily have control over at OSD, but certainly would engage with our partners in other departments on those conversations.
MLA Rankin.
Thank you, Madam Chair. And relative to a potential recession that we might face, and the mention of tariffs and the impact to the economy, would the department agree, and this is what I've come to understand through experts in the field, that the funding that government gives to the most vulnerable, especially income assistance, but the other programs, basically gets spent, and that the money that, if we do face a recession, would the department agree that the most effective way to put government money into the economy, therefore to stimulate the economy, is to increase all of these supports for the most vulnerable families? And would the department endeavor to request increases to these programs if we actually do hit the recession that many think are coming?
Deputy Beaton.
Thanks very much. I think there's, obviously some speculation in there about whether or not we would or hit a recession. So I can't really say what would happen if. I think we would address it at that current time. I think of how government responded during COVID, and I think it was an all-of-government approach. Should we find ourselves in a situation where tariffs have an impact and put the economy into a recession, I would think that we would certainly play a role in that in terms of advising government on how best we could support Nova Scotians, particularly those that are most vulnerable, and I'm sure OSD would be part of the rollout of that plan.
MLA Rankin.
Thank you, Madam Chair. Appreciate the answer, and I'm glad you mentioned COVID, because one of the things we did during that time was look at the gaps in terms of food. And since that time, we have food pantries set up across the province. I have one literally that I helped set up at my office. And every single evening that I'm at my office, people are coming in. They tend to come in the evenings so that they avoid the stigma of being seen. It's a big problem. So we did have one-time funding go to various groups across the province. I'm wondering, even if we don't have the recession, this is a problem now, but I know we fund Feed Nova Scotia, but that funding does not end up with these organizations that do such great work, and some of them are expanding to community fridges so that we have perishable items and such, but we need a lot more support. So I just asked the question because the demand is by far outstripping the supply, at least in the Timberley area, and I could expect in various other areas. I know in Cole Harbour and some other places that I visited. Given that what we're facing is actually even more, I think, extreme than what we even saw during the pandemic in terms of food insecurity, will the department entertain looking at some, at least one-time funding? Obviously, recurring funding would be great, but some one-time funding for these various community organizations that are having a challenge keeping up with the demand.
Deputy Beaton.
Yeah, thanks for the question. And food insecurity obviously is, you're right, it's a very salient topic right now that affects a lot of Nova Scotians. You mentioned the increase to Feed Nova Scotia. The other groups that we work with are the collaborative food networks as well. And food insecurity is not necessarily just OSD, although we do play a role in that. We also partner with our colleagues over at CCTH, and they work with various organizations, including Nourish Nova Scotia. Department of Agriculture also plays a role in this space. So there are a variety of programs that individuals can apply to and organizations can apply to help address food insecurity. We hear from our service providers, and we do know, as I think I mentioned earlier, as part of our our multi-year service agreements that we have with them, there's a bit of back and forth with our organizations around what their needs are for the coming years. Obviously, with inflation and other things, it's no secret to see the budget requests for food in particular have increased across most of our organizations that we support and that we work with, groups like Family Resource Centers and others that are doing work in community. So, you know, when there's an opportunity for groups to be able to submit proposals to the department, we certainly would look at those, and where we have the budget capacity to support them, we certainly bring recommendations forward to the minister to be able to consider those.
MLA Rankin with 1 minute.
Thank you, Madam Chair. And you mentioned HST has decreased. However, families are still paying tax on car seats. I know that because I've purchased car seats now in that time of my life. But they cost like $500 or $600 for a good one. So what I'm seeing is that families that don't have the means are actually buying used ones that could be expired. So Ontario exempts the provincial part of HST. I'm just wondering if you would advocate to take the tax off car seats for families in Nova Scotia.
Deputy Beaton.
Yeah, thanks for that. I think we would obviously entertain discussion about it. First, we've not had any requests to that extent that I'm aware of, but certainly, you know, if people had requests, it's something that we would look at and do some analysis on it and bring forward into government with recommendations.
Thank you, and the time has elapsed at this point for the Liberal Party. We will move on to questions from the PC Party, but first we have an arrival. I would ask my former seatmate to please introduce himself.
Thank you, Chair, and my apologies for being late, but I am Brian Wong, MLA for Waverley Fall River Beaverbank.
Thank you, MLA Wong, and who will be, I would recognize MLA Macquarie.
Thank you, Madam Chair. We understand that there has been a lot of media coverage and announcements coming from your department, which cover the vast work being done across your many programs and initiatives. We want to ensure that we are using our time in this committee to inform the public clearly and concisely of all that is available to those in need of support. So I will start by being clear that many of our questions today will be intended to give you a platform to speak to these measures. We really appreciate it. Can you tell me about the changes you have made to income assistance over the past few years?
Deputy Beaton.
Yeah, thanks very much. Thanks for the question and the opportunity. I think, you know, spoke to a few of these earlier, but I'm happy to sort of kind of go into a bit more depth on them. But in terms of income assistance, currently right now we support about 37,000 Nova Scotians who are currently on income assistance, roughly about 3% of the population. Roughly around 24,000 households as well. So it's a significant number of individuals. I think I mentioned earlier, we've increased income assistance in the last year by 2.5%. There's also been an indexing of income assistance, which I think is probably the biggest benefit that we'll see. And in addition to that, we've had the disability credit supplement that's been provided, not credit, and that was a $300 increase. I've also mentioned about that. We've increased school supplies last year on supplies for individuals that were on income assistance, and there was $100 for youth that were of families entering into elementary school, and it was $200 for junior high and high school, and that was a benefit that we provided in August of last year, leading into school, recognizing the cost of school supplies and the impact of that. I also mentioned the disability credit or disability supplement. So for those 12,000 Nova Scotians that received that $300, there was also a one-time payment to those that were not eligible for that supplement of $150. So there was an additional investment that was provided to folks on income assistance. The other piece I think that is really important is we've also increased the amount of earnings that individuals can receive before there is any impact on their eligibility in terms of what they're eligible for income assistance. So that amount increased by $100 and is now up to $350 per month that individuals can earn while on income assistance without having an impact on the benefits that they receive.
Thank you. MLA Macquarie.
Thank you very much for that answer. We understand that there are programs that assist recipients of income assistance to transition to employment. Can you share a little bit about these programs and who they support?
I recognize Deputy Beaton.
Thank you very much for the question. So there's a variety of programs that we have. So ESIA, so income supports, employment supports income assistance has two divisions. There's an income assistance division that predominantly has caseworkers that work directly in support of providing supports to individuals that are on income assistance. But in addition to that, we have employment support work, so ESS, which is a separate division. In conjunction with the ESIA, and their work is primarily about breaking down the barriers associated with reentry into employment. That could be things like, resume writing. It could be, the purchasing of equipment to be able to enter into the workforce. It could be upskilling. There could be education. There's a variety of tools that we would have and a variety of programs that individuals who would be on the income assistance caseload would be eligible to be able to enter into. And that navigation is really done in conjunction with their caseworkers. We have a variety of programs as well for youth to really break that generational cycle, because what we do know is that there's a number of factors that contribute to poverty, and access to education is one of those. We do know that there's also the ability for individuals to be able to have secure employment, and to be able to be in that employment is also a barrier. So we do have a significant focus on the generational impacts of those. One of the biggest predictors of somebody ending up on income assistance is actually whether or not their parents were on income assistance. It's roughly about 14% of individuals that are on income assistance were a child of somebody that had been on the caseload previously. So a lot of our work is preventing that from happening and sort of breaking that cycle, particularly. So we have a number of youth-related programs that impact those, programs like EDGE, programs like PATH. I spoke a little bit to a previous question around Career Rising, where we can support the costs of tuition, partial tuition books, but also allow those that are young on the caseload, 18 or over, to be able to go back to school and keep some of their benefits while they're actually doing their education, whether it's in a private career college, NSCC, or in university.
Emily McQuarrie.
Well, that was such a good answer that you also answered my next question, which was about breaking the cycle of dependency on income assistance. So I'll pass on the floor to my colleague.
Okay, I recognize MLA Timmins.
Thank you. Oh, thank you so much, and thank you for coming. I grew up in a family, and I do recognize the family that MLA Hammett had mentioned. My family, when I was young, grew up in a low-income family, and we basically relied on community services. I admire the changes that happened over the years, for sure. My father, again, he had a disability, and my mother had 8 children. So we struggled. And all of our family, our children, had to work to help support the family. We grew up on a hobby farm, so thank goodness our food security was there. So basically over the years I've seen much changes. I was able to go to school. I was blessed with a hardworking parents, or showed us what hard work was about, living on a farm. So I was able to get my education. I was a young single mom. So my husband and I basically said to ourselves, we're going to work harder and break the cycle. And we were fortunate enough to do that. There's many families that don't. And my goal over the years was to support the families that were, because I worked in community development, and I worked in those service providers that looked for funding to help break cycles and support families. I also worked in an MLA's office, and so I admire the changes that happened, and there was some gaps. Certainly that we worked as within the MLA's office to try to build with service providers and connect the dots between community service clients and the workforce as well. So I admire the changes that happened over the years, and I'm very excited to hear about pathways as well. I know they've changed it in different formats over the years as well. And with families being in a disability, you've changed the support systems. Can you talk a little bit more about the programs that you support within the system for bridging those gaps as well, and also to support the people with disabilities? And I know you did talk about a little bit about it, but if you can just mention some of the programs that are further existing within the rural areas.
Deputy Beaton.
So could I just ask for one point of clarity? Are you specifically referring to the employment-specific programs or disability programs, or both?
MLA Timmins.
Let's work with the bridging program for the work programs that you are introducing to people that are on community services.
Deputy Beaton.
Sure. So I think one that you may be referring to is the PATH program, and the PATH program is financial support that we provide for youth who are exiting care and custody of the minister. That program provides ongoing support for daily living costs. Tracy will have the exact numbers, but I believe it's up to 6 years, and they're provided income to be able to transition into stability and into employment for those 6 years as they move off, as well as education programs. But I might ask Tracy to maybe talk a little bit, if that's.
Recognize ED Embrett, please.
Thank you very much. The PATH program is a program that was was initiated and rolled out in January of last year and of 2024. It is a program that focuses on funding concrete supports in funding, as well as supports through Family Service of Nova Scotia, and it is for youth in care or youth in care who have reached the age of majority, either 19 or 21, and it's also for youth who have been enrolled in a voluntary youth services agreement. So these would be youth that there has been a substantiated risk that they cannot live safely with their parent or guardian, but they are between the age of 16 and 18 up until their 19th birthday. So children at that age are not brought into care of the minister, but definitely there's a noted and identified need for support at that time and going forward. So when we talk specifically around affordability and challenge and being successful, the resources and the foundations that some of these young people have may not be the same as someone who's grown up with their family and maybe 24 and still living at home. So this program has been very successful to date in supporting youth with an income. So it is essentially an income of $20,000 per year at the age of 19, and there's a decline of $2,000 a year until the youth turns 26. It is voluntary. It's not required. If a young person does not want to participate in the program, that's their choice. The funding is provided biweekly, and there are regular check-ins. That is a caveat to the program, that there is regular check-ins with Family Service of Nova Scotia, who's a wonderful provincial service provider who supports a lot of our prevention programs as well. So the supports there could be anything. It could be budgeting support. It could be support to help find a job. It could be somebody to help navigate relationships and decision making as these young people are navigating adulthood, just like every one of us did when we turned 19. I was, yeah. So a very helpful resource for them. They still have a connection to their assigned social worker as well, or a social worker with the department. There's even a 24/7 hotline or telephone line specifically for these youth. So it really does extend that care and support beyond 19, where years previous, when a young person in care turned 19 or 21, sometimes their only option was income assistance. We also support youth post-care in a post-care and custody agreement if they are pursuing post-secondary education, whether it's training for a trade or any other formal post-secondary. It could be a dog grooming course. It could be whatever they choose to do. So the post-care agreement would support living expenses during the time of the educational pursuing their educational goals, and the PATH program funding and support is available in addition to that. It's not means tested or needs tested. It is an automatic to anyone who enrolls with it.
MLA Timmins.
I'm just going to change the subject to foster care, if you don't mind. We heard a lot about Mockingbird, the family, it's Mockingbird family model. I do believe it started in Cape Breton. You may correct me on that. But if you could talk a little bit about it and how it is moving forward to assist foster parents.
Ms. Embrett, please.
Thank you for the question. I'd love to talk about it. A Mockingbird family model of service delivery has been adopted by the Department of Opportunities and Social Development as a foster care redesign. We began with a one-year pilot in Cape Breton in a rural setting in Marionbridge. And we had an experienced service provider, an experienced foster caregiver who was willing to do the trial with us. And we also had a second, more urban constellation in the Preston Townships area, again, with a very experienced and respected foster caregiver. So the Mockingbird family approach looks at, we shifted from foster caregivers needing to use their own money and submit receipts and get reimbursed for expenses for caring for children to paying them a biweekly amount based on the assessed needs of the children in a block funding, if you will, manner, so that foster caregivers could plan, and if they're planning for a vacation or if they want to register the child in care who they are caring for in their home for basketball or hockey or ballet or art classes, they have that funding to do that. So the other important piece around the Mockingbird family approach is that we do have foster caregivers in constellations. So it's a constellation or a gathering, if you will, of 6 to 10 foster caregivers with a lead hub home. And the intention of that is to emulate what an extended family looks like. So it's been incredibly successful. We still need foster caregivers. We need more. We need to have more foster caregivers than we have children in care in order to make sure that we keep children in their home community and in their own school and close to their parents, because when a child is in care, our goal is family reunification until it absolutely cannot be. So just a couple of success stories. We've had one constellation go on a family summer vacation together. They did T-shirts and they went on a camping trip together as an entire family. Another success story is, unfortunately, sometimes there may be a breakdown in a placement in a home. And there have been a number of occasions where there was a breakdown in a placement. However, the child was able to stay in the same constellation. So it wasn't a broken relationship, it was a break. And a break for the foster caregiver, maybe a break for the child, but there was no loss of connection to the community that that child felt part of. If there's time, I will also share another success story, and that was when there was a medical emergency with a foster caregiver. A few years ago, those children may have been picked up by a social worker and transferred to an emergency foster placement anywhere else in Nova Scotia. In this situation, the foster caregiver called 911, and then they called the hub home. And the hub home said, "Don't you worry, you put the knapsacks on the front steps. We'll go pick up the boys from school." They knew who was coming to get them. They were able to support that when the youth were scared. There was a hospital stay, and they were able to keep the youth in the hub home, in the community, go to the hospital for visits until all was well and they could return home with their foster caregivers. So certainly less disruption for children, and definitely an increase in funding for foster caregivers so that they can ensure that the children in the care of the minister have the exact same opportunities that any of our children do.
Thank you. Emily Timmins.
Thank you so much. I really I appreciate what Mockingbird is doing for the community, for sure. I have one other question regarding housing. There has been a lot of work done around housing support. Can you share a little bit about what's going on? I know in Cape Breton, the community housing first had the 35 pallet shelter homes, basically, it's near the. I'm sure you know, of course, know enough about it, but I'm just wondering about the connection between Housing First and the support that community services provide for individuals that were homeless and that will go into these homes, and the support that will be provided for them because of this. Deputy Beaton, please.
Yeah, thanks very much for the question. And I think you're referring to some of the work that we've done around supportive housing, which we believe is also a measure towards supporting individuals with affordability. So we have one element of housing within our department. It predominantly focuses on homelessness and the prevention of homelessness, but in doing so, we're part of the continuum of supporting the supply within housing. Part of that is supportive housing. So we do have a supportive housing action plan. That plan was developed 3 years ago with the intention of creating an additional 1,085 units. We're actually a year ahead of schedule on that. Within that, you would see things like the 70 tiny homes that we've had completed in Sackville, Nova Scotia, which give people their own space and a place to call home. We also have the 200 shelter village sites, the ones that you refer to in Sydney, so those have also been completed. The impact on that has been significant in terms of the number of people that we've been able to support off of what's called the by name list, where people go who are precariously housed, indicating that they need housing. We also, as part of supportive housing, we work with a number of service providers to be able to, support individuals who are on the cusp of being what we would say unhoused. And there's ways that's done through service providers, through one-time supports to be able to give them, support towards their rent, potentially. Diversion funding is typically the way that we approach that. We've invested about $12 million in the last year to be able to support diversion funding, because the best way to support homelessness is to keep people housed, and that is one of the areas that we've invested a lot of time, and the team has done tremendous work to be able to support that. Those diversion supports also can support service providers being able to provide first month's rent, as an example, or a damage deposit. So these are other avenues that we think address the affordability for individuals that are seeking housing as one of the key barriers for them in terms of affordability. Government also has this fairly significant rent supplement program that they've advanced, and in terms of housing, also a very sizable investment in public housing this last year of $1.5 billion to increase the continuum. And in terms of the work that we're doing around homelessness, we can tell you that supply that's going on has certainly significantly impacted our work in terms of making sure that individuals and communities are getting adequate housing. And working with the service providers, they're able to navigate and determine who are best suited. So we have a whole range of housing supply now that we think meets the needs of individuals where they currently are.
Thank you. If I understand correctly, that was the final question, or did you? Okay. Recognize MLA Stoylov?
Yes. Thank you, Madam Chair. Thank you all, by the way, and I just want to say you've answered every question with such detail, and probably have answered a couple of my questions a little bit, but nonetheless, let's elaborate on a couple of them. Regarding income assistance, I think Deputy Minister Beaton touched on a bit with the Nova Scotia child benefit, which is used to support low-income families. Can you elaborate a little bit more about that, how that works, a little bit more detail, I guess?
Okay. This will be to Executive Lead Egerton.
Thank you very much. Thank you for the questions. So the Nova Scotia Child Benefit is a monthly benefit that is provided through the taxation system, so it's a very efficient delivery. And it affords Nova Scotians who have a child in their household with an amount that is, it starts at $1,525 for your first child. It provides that to you on a monthly basis. And so it actually helps support just shy of 40,000 children in any given year, and that's about 22,000 households. It comes at a cost of around $54 million, 24-25. I was going to say to date, but I guess 24-25 is now done, so $54 million for the last tax year. So it works by giving an amount of $1,525 for households up to a $26,000 threshold for each child that they have. And then for those who are in households of between 26 and 34,000, there's a slightly diminished level for your second and third children in those households. It is a very efficient, like the administrative burden on that is very slight because it's delivered through the taxation system. So the only eligibility is your income, do you have a child, and have you filed taxes the year before. The rest is an automated system. And the one other thing I would add in is that if you are eligible for the Nova Scotia Child Benefit, you automatically are eligible for a pharmacare program for your children, which affords you pharmacare for $5 copay per use. So that is obviously a significant benefit for those who may be requiring pharmacare in any given year.
MLA Stoylov.
Thank you very much. I'd like to talk about the HERD, especially at election time. It came up almost at every door, and I can tell you that most families that I spoke to at the door were just liking the school lunch program. It's really gone over well. I just want to know if you can maybe, let us know a little bit more about your department and how you work with that school lunch program and anything that's might be happening in the future on bringing more schools on board.
Deputy Beaton, please.
Thanks very much. I think I can just maybe start, and Nicole has been one of our leads on the implementation of the school lunch program in conjunction with the Department of Education. So I think I would let her maybe give you a bit more details. But obviously, when you talk about affordability and the impact on families, having every child being able to have the ability to have a healthy, nutritious lunch, we do know has significant impact on education outcomes. And also just their overall health and well-being. So I think school lunch is much broader than just about providing a nutritious lunch. It's also about really addressing what we would say are those underlining social determinants of health. So in terms of the client base that we're supporting, we do know that food insecurity does have a big impact. So our role in terms of devising that was to ensure that the lens from OSD was included in terms of how our clients would be benefactors of the school lunch program. In terms of the details of how it works and how it rolls out, as well as the evaluation, I think I would ask Nicole to maybe give you a bit more information on that.
Would recognize Ms. Hazlehurst.
Thank you. Thank you, Deputy. Can everyone hear me? Okay. So last year we worked with a team from across government, including education and health, to design and implement the Nova Scotia school lunch program. The program itself was implemented in October 2024, and it follows a pay what you can model to ensure that all students have access to nutritious meals without financial barriers. So families can contribute up to $6.50 per lunch, a portion of that or nothing. And payments are made confidentially through an online ordering system to protect privacy. So families don't have to explain or prove why they've chosen to pay the amount they've selected. The first phase of the school lunch program included 258 schools across the province. So that reaches about 75,000 students. And it operates alongside other school food initiatives like the free breakfast program. So this ensures that students have consistent access to nutritious meals throughout the school day. The program itself offers a rotating menu of 40 lunches, and students have access to 2 options every day. For the menu itself, we worked with chefs and dietitians to design it to make sure that all of the meals are nutritious, and so that we could offer students a mix of those familiar favorites like cheese pizza with a side of vegetables, but also some of those new flavors as well. Earlier this year, you may have heard the program had an important milestone of 2 million lunches served, which is absolutely incredible. And we continue to support our colleagues at Education with the ongoing monitoring and evaluation of the program.
I'm sorry, that does fill this particular time period. I personally regret having to interrupt on that particular topic. We do have about 30 minutes left in questioning, and we will divide that evenly between the opposition parties and the government party, beginning with the opposition parties with 15 minutes, and I would recognize MLA Hanson.
Thank you, Madam Chair. So I'm going to just go back to child poverty because I think we need to kind of get grounded in the reasoning why folks access the services they do, because we know that over 40% of Nova Scotian children live in poverty in Nova Scotia. Poverty rates are particularly high in Digby, Annapolis, Cape Breton, and Queens. So my question to the department is, do you have updated data on how many Nova Scotian children live in food insecure households? And are you tracking communities based on their various backgrounds? And then my second part is, what is the department's poverty elimination plan, including targets and timelines to end child poverty?
Deputy Beaton.
Thank you very much. I just wanted to make sure I didn't miss both of your questions. So in terms of tracking data, we have robust data within our department. We do look at a variety of different inputs in terms of how we're measuring, which is why, one of the reasons for the indexing of the income assistance would have came from us, looking at the data and what the impacts are of the consumer price indexing, not necessarily keeping rate with inflation, our particular program in question. But in terms of the backgrounds, maybe I'll just get you to repeat that. Sorry, I'm focused on the timeline question, if you don't mind.
I would recognize MLA Hanson.
So, obviously the data is being collected. I was just wondering, are you also tracking those communities with the various backgrounds? So, disaggregated data based on, where they're from, culture, all of those pieces.
Deputy Beaton.
Thanks very much. And sorry for not having that right off the bat. But we do have a breakdown based on communities that would be receiving income assistance. We do it based on region. So we would have 4 regions in the province: Northern, Western, Central, and Eastern Zone. In terms of aggregated data based on breakdown of certain barriers, whether it's related to race or gender, sexual orientation, et cetera, a lot of that is done through our race-based data collection process that's happening broadly across government. So we wouldn't necessarily have the exact breakdown in terms of various communities on that right now, and that initiative is still developing. So, because not every applicant or intake process that we have do we require self-identification, so it's really hard to get to some of those pieces. But you know the points you make, I think some of the things that we look at when it comes to child poverty, and I think I've referenced some of this earlier, are ensuring that we do have awareness around some of the factors that influence poverty, which is access to stable and ongoing employment, access to education. We do know that there's structural and historical barriers faced by discrimination on certain groups, as well as intergenerational factors. And a variety of our programs do look to address those issues as it relates to supporting individuals being more self-sufficient.
MLA Hansen.
Thank you, Madam Chair. The programs are amazing. There's a number of initiatives across the province and that are happening in community through resource centers, through other supports, and we applaud those things because we know that they're needed. And a lot of the times we see that there are gaps, i.e. when we're talking about financial numbers for folks who are living in poverty. So I say these things because there's a number of issues that we see across departments, and it's good to hear that there are some collaboration within departments working together to get things done. I would really hope that your department is advocating for more funding to be able to close that gap, because we know that as time goes along, we get further and further away from where we need to be to make sure that people are in a safe space and a safe place. So I'm gonna shift to homelessness, because that was talked about earlier about some of the programs when it comes to homelessness or at risk of losing housing. Families living below the poverty line are at risk of homelessness, and I know folks see it all the time. Can you tell us how many families are currently homeless that you work with, or that you are aware of that you work with in your department?
Deputy Beaton.
Thanks for the question. I actually didn't get to your previous question about the timeline, so I don't know if you wanted me to go back to that or if you just want me to move on.
Recognize MLA Hansen.
I would love a timeline.
Okay.
You go ahead. Sorry, I jumped the gun.
Deputy Beaton.
Well, sorry, I should have managed expectations because I don't actually have a timeline to give you. But what I can say is obviously timelines in terms of an overall report in terms of how we address affordability. I think I would go back to some of the work that we've been able to achieve in the last year, and a lot of it has been at the hands of doing things cross-departmental. So I don't want to underscore the impacts that we've had in terms of our department of indexing and some of those other pieces to address that, but also the employment supports. But I think even more is some of the investments that we've seen corporately, which we do know have a direct impact on our clients. So I think I referenced earlier, like affordability across all departments, including Department of Finance. So those increases on basic income tax thresholds, the other increases we've seen around rent supplement programs and public housing, those all have a direct impact. So I think what I wanted to do was just to make sure that you knew that we're working in tandem with our other departments and really focusing on action and not necessarily just on a direct timeline. We know that we're not going to dig out of this quickly. It is a continuum, but I think the supports that we have in place and really about trying to prevent it from happening in the first place is really the focus of the department right now. Yeah, so on to your second piece around homelessness. Yeah. So I think I don't have the number off the top of my head in terms of how many families. I do know the number of individuals as part of those family groups is roughly around 200. We've talked a lot about, you probably have heard in the past, in own estimates, the minister was quite, excited about the rows, and rightfully so, because those types of impacts do really break the generational cycle of poverty when you actually can have people that are housed securely and not living in hotels. I think the number isn't around, but we will get the number for you. I think it's around 80 families that we're currently working with that are what we would say homeless right now. So that the team has done exceptional work listening to our service providers. They're the ones that really are on the front lines and giving us a lot of impact, which is, the Rose, to me, is such a huge success story, not only because of the impact that it's going to have with families, but the timeline. Like, it only came to, it was essentially a concept 10 months ago, and now we actually have people that have moved in there. So that's not all government's work, although government moved really quickly with our colleagues at Public Works to be able to make that space available, but the service provider quickly went in there and was able to, to have that. And we're going to have 24 families that are going to be in that unit. There's also, 30 families that have been supported in Dartmouth as well through another program. So the department's done an exceptional job, I believe, in terms of really trying to address the needs of families and really get kids and families out of hotels. I've only been there 10 months, so I can take very little credit for that. A lot of it is the work of the team prior to, but it's really been exceptional to see, and the impact that it has on families and youth as they're able to find secure housing.
MLA Hanson, just for time management, we're now at about 6.5 minutes.
Thank you, Madam Chair. And I'm glad to see the urgency, because 10 months in and all of these things are happening because we know that there's a need for that. So I think, I'm glad to see that that's working, and that we're working with service providers across the province. So was mentioned the diversion program to help keep families in their homes. Can you tell me how many families received funding to help with overdue power bills, rental arrears, or barriers maintaining housing? Is there a number, or is there an amount that you've been able to allocate for that program?
Deputy Beaton.
Yeah, sure. I do have some information on that in particular. So in terms of diversion support, I don't know the exact amount, but I can tell you that through the program funding that we were able to provide to service providers, it would have been estimated that we prevented more than 1,000 Nova Scotians from becoming unsheltered in the last year as a result of that investment. Yeah.
MLA Hanson.
Thank you, Madam Chair. I'm grateful for that. We make those calls all the time. The Canadian Centre for Policy Alternatives Nova Scotia's office has argued that strengthening tenant protections and tying rent control to the unit close to the close the fixed term lease loophole would help protect both the tenant and keep folks in affordable housing. So, and the children's right to stable housing. So I'm just wondering, as we advocate for multiple things across departments, is this something that your department is advocating for as well when it comes to tenancy protections?
Deputy Beaton.
So we work quite closely with the Department of Opportunities and Growth and Development, who have the housing portfolio. It was previously with Municipal Affairs and Housing. And I know our teams talk a lot about what's the best way to do prevention. And so I can't speak specifically to what you're asking in terms of that particular question, but I can tell you that our teams are pretty much joined at the hip in terms of supporting, because a lot of our service providers also work with Opportunities, Growth and Development around the rent supplement program that's administered by them. So, I think through their collective work, they look at a variety of policy measures to ensure that people stay housed or be able to adequately build the supply, which I think I referenced earlier.
MLA Hanson.
Thank you, Madam Chair. And I'm going to pass it to my colleague.
Recognizing MLA Hamid.
Thank you very much. I recently came across a report that was done in BC that compared the funding that families who are fostering receive versus families through kinship care receive, and there seemed to be quite a big gap there, and I'm wondering. I haven't done the digging yet. I just saw that yesterday, but do we have any sort of information about where that is in Nova Scotia? Do we have a gap, and if so, what are we planning to do to close it?
I recognize Ms. Embrett.
Thank you for the question. When we shifted to block funding for foster care and foster caregivers, inclusive in the foster caregiver group is kinship caregivers who historically have been a close connection through relative or a pre-existing relationship with a child. After the development of the kinship foster care caregiving category, if you will, we also rolled out a new program a few years ago called alternative family care. So when a child is placed in a foster home, they are a child in the care of the minister. In order to not need to bring children into care, we developed the alternative family care program, which is when there is a child who may be, or a family where there's a risk that the child may need to be brought into care for their safety. We will work with the family to see if there's someone in that family circle, someone who loves that child and will care for that child so that there is not a need to bring that little one into care or the youth into care. We've recently increased the monthly amount from $250 a month to $750 a month per child for the alternative family care. It is less than what a foster caregiver would receive, and we are looking at that.
Thank you. MLA Hamid with about 1.5 minutes left.
Thank you very much for that. I appreciate it. So I guess we'll touch on this quickly because this might be several departments, but in the most recent budget, it was estimated that changes to HST, the basic personal amount, the bracket indexation would save families about $1,000 a year. Can you tell us how much, do you know, or I guess would you know roughly how much a family earning income assistance will save as a result of these measures?
Deputy Beaton.
So we would have to do the math on that because every situation will be different. But I think generally, $1,000 per year is what we've also been kind of working with. It all depends on what tax bracket they'd be in, a number of factors. But we would have to do the math and be able to report back. Yeah.
MLA Hamid.
Thank you all very much for your time today. Really appreciate it. I don't think I can squeeze another question in. Thank you so much.
Thank you.
Thank you, and that does cause the time for the opposition questions to elapse. So we will move to the PC party, and I recognize MLA Macquarie.
Thank you very much, Madam Chair. How do you ensure that programs aimed at reducing financial barriers for children and families are fair and equitable, considering the varying needs of different communities, such as our rural communities?
Just looking for a signal, and I would recognize Executive Director Embrett.
Thank you. We have 28 now family resource centers, which go from one end of the province to the other. And we have about 80 programs in total that we fund and support through prevention and early intervention. Definitely with a focus on rural as well. We want to ensure that there are no gaps in services and supports for families. I'll take this opportunity as well to share that as our increases in prevention and early intervention programming, which range not just around family resource centers, we have parenting programs, we have strengthening fathers programs, which are grassroots community programming to address the needs of address needs and support father figures, men and boys, prior to something happening that may result in violence. We have youth outreach programs. We have Families Plus programming. And again, the focus through prevention and early intervention is to address all of the geographical needs as well. We have been, I think I missed the opportunity in a previous question to highlight that the numbers of children in care are continuing to slowly decline in Nova Scotia, which is wonderful. And we are also seeing the numbers for alternative family care, which I referenced previously. Those numbers are actually down over the last year as well. But we know that our engagement numbers with our prevention and early intervention service providers across the province are increasing, which is really, really wonderful news. We want to support children, families, individuals in their community where they're at, long before there needs to be any more intrusive or formal involvement with the department.
MLA Stoilev.
Thank you, Madam Chair. I thought it would be right before we ask more questions that I would ask Nicole Hazlehurst if she wants to finish what she started before we ran out of time on the school lunch program.
Sorry, I recognize Ms. Hazlehurst.
Thank you for the opportunity. I was just going to add further to what Deputy Beaton had said around how the school lunch program is a significant step in addressing food insecurity among children, as well as supporting their academic success and overall well-being. So when kids are hungry, it's hard for them to learn, and we know that healthy food at school supports their learning, behavior, and overall well-being. And this program is an example of how our department is working collaboratively across government to address affordability and reduce financial barriers for Nova Scotians.
Thank you.
Thank you.
Thank you. Recognizing MLA Wong.
Thank you, Chair. And thank you for what you do. It really is one of the most important things that we can do is help families along and try to make them successful. My career was around education. I probably spent half of my career as a teacher and half as a principal at all levels. Food insecurity was big, so I really appreciate that. But transitioning as well, transitioning out of school, whether you transition as a graduate or you transition before you actually graduate, and then on to post-secondary for some or directly into the workforce. So it's big and it's important, and that's why work-integrated learning is really a focus right now, because we want youth to try things out, and it also gives them the opportunity to try different types of jobs, and it gives the employer to also look at to help that student or that youth transition themselves and help guide them. And I think relationships are key. So that really brings me to the EDGE program. So I think that goes to ED Embrett to really talk about the EDGE program and that whole how to support youth in transitioning successfully into the workplace.
I recognize ED Embrett.
I think the deputy is going to respond to this question.
Sorry about that. I recognize Deputy Beaton.
Yeah, thanks very much. And the EDGE program, it started out a number of years ago, back in 2018 as a pilot, and in 2023 we put the program in permanently. It is a great program that can help youth transition to employment, and it does provide intensive on-the-job supports and training for youth that are looking to enter into employment, exiting income assistance. So it is a program that we offer that supports youth that are aged 18 to 26. Interesting to see some of the stats that we've had from the EDGE program, and that 40% of those that actually enter into the EDGE program are finding employment within 6 months and staying in that employment. And it's typically they have employment for mostly full-time work. The focus on early prevention of getting youth into employment that are off of income assistance has been a real focus for us. The budget, in fact, for employment supports doubled in the last number of years from $9 million to $18 million. Because we know that just over 20% of income assistant recipients are currently participating in our employment support programs. It was referenced earlier that not all are able to be able to find their way into employment supports. But we think that we can build on that, and that is going to be a significant focus for our department, and we continue to kind of work on that, which is increasing the number of folks that are accessing our employment support programs to really find them the opportunities to make their way back into the workforce. Currently, right now, within that, we have about 22% of the people that we're working with are exiting every month into employment, and the EDGE program has been a significant contributor towards that.
Emily Wong, do you have a follow-up?
And thank you, Chair. And yes, I do. I'm just wondering if kind of what the stats would look like maybe in HRM compared to maybe the rest of Nova Scotia to see the success or the number. I know there's going to be a higher number here, but percentage-wise, is there more participation in certain areas of the province?
Deputy Beaton.
Yeah, thanks. I do have some breakdown of some stats and participation on the EDGE program, which I can refer to here. Between 2021 and 2024, we had 530 individuals participate in EDGE, and again, it's a select group, but it is about breaking that cycle, that generational cycle of dependence on income assistance. 249 of those were income assistance. 172 completed the EDGE program within 6 months. A survey found that participants found that 75% of those that participated really felt that the program absolutely improved their communication and job-related skills and increased their confidence at work. EDGE providers, because we do have people, service providers that actually offer the EDGE program on our behalf. So a couple of examples would be in North End, Halifax shows you a bit of a growth of where the programs come in terms of awareness, and also our case management and our service providers referring, our income assistance workers referring folks through to EDGE. But in Northern Halifax, where we had 3 participants in 2021, this year we had over 43 participants in that program, which is, a significant growth in terms of the participation and the success. In Cape Breton, there was 13 participants in 2021, and this year there was 58 as of November. So in terms of the actual regional breakdown, I don't have that on hand, but those are the stats that I think do speak to some of the growth and the awareness. I think it would be equal growth across the province. All our service providers that have this program do a great job of trying to reach the youth that would be eligible to apply for this program and be part of it. Yeah.
I recognize MLA Wong.
And thank you for that. It sounds like it's a great program because as educators, once kids leave our schools, we lose track of them for the most part. And some, you hear through the grapevine. But it's nice to see those programs that are available. So kudos to you. But so on the other kind of end of the spectrum is really the early intervention program. And I did notice that there's an increase in budget. So I'm just wondering if one of you could speak about the early intervention program.
This time I'll get it right. Executive Director Embrett, please.
Thank you very much. Our annual budget did have a 3-year investment that began in 2021 of an increase of $11 million, and we had an additional investment of $9.3 million in 23-24, and that was around the implementation of the PATH program. Often when individuals hear about prevention and early intervention, your thoughts may go to the early years, but our prevention and early intervention programs are early, they're through the teen years, and they're post as well. So our youth outreach programs, the PATH program goes up until the eligibility is up until the 26th birthday. So we really look at having prevention and early intervention complement any involvement that we have or don't have. So complementing our involvement with the youth in care or complementing a community. And we just hear the good news stories that our service providers are able to support the families. I have some data that I can refer to. the approximate number of families supported by Family Resource and Parenting Journey programs in 23-24 was 8,300. And the Youth Outreach Plus program has served over 110 youth since its implementation. Youth outreach programs have supported 1,600 youth in 1 year. And Strengthening Fathers, I referenced earlier, which is a community-based program to bring father figures, men and boys together to talk about violence and their experiences. They have supported approximately 750 fathers as a prevention gathering, prevention approach to address family violence. We also have a Place to Belong program is largely available across the province. It's for children aged 5 to 15, and in the 23-24 year, approximately 1,600 children were served and supported by that program. I would like to take the opportunity where we're talking about affordability as well to bridge a little bit to another program that we haven't been able to touch on yet, called the financial stabilization payments. So that is a program that we rolled out about 3 years ago. I can't recall the exact date. I think it was the fall of 23. So that is a program that we recognize that when there is an unfortunate circumstance where a child needs to be brought into the temporary care of the minister, there's an unintended impact financially for a parent. So parents who are in receipt of the Canada Child Benefit, which is a federal program, are only able to receive that if they have care and custody of the child. So when a child is brought into care, any jurisdiction in Canada who is involved with the family makes application and notifies the federal government that the child is now in care of the province. There is a diversion of the Child Canada benefit to Children's Special Allowance, which is paid to the province. We've recognized that this unintended impact is that on possibly one of the worst days of a parent's life, they are also possibly financially destabilized as well. So while we are working with them to make sure that all concerns are addressed and their children are able to safely be at home, they may be struggling to make rent. So we have this new financial stabilization payment program where once we apply, we immediately replace the lost income or the lost monthly payment for the family, and we do that throughout our involvement, and hopefully we are able to successfully reunite the family. We will continue to do that for 3 months after reunification, or unfortunately if a child must be brought into permanent care, we still continue that payment for an extra 3 months. So that is
Order. The time for questions has elapsed. I would like to give the opportunity if any of the witnesses would like to make closing comments. Deputy Beaton.
Sure. Thank you very much. Pleased to have the opportunity to join you here today and appreciate the thoughtful questions and the discussion. As you've heard, there's a lot of work underway within the department, but also right across government to address affordability for children and families. We've been able to outline a few. There's many other initiatives here that we could have talked about as well, but we definitely feel like at the department and across government in terms of some of the corporate initiatives that have taken place in the last year, that it will have a significant impact on families and children in the province. So we're pleased to see that, and we know that that we're not stopping there. That there's work that we need to do with our partners and across government to continue to support communities and Nova Scotia families going forward. And with that, I would just say take the opportunity to do a big thank you to the many service providers that we work with across the province In addition to that, to our staff at the Department of Opportunities and Social Development, of which, they show up every day to support Nova Scotians, many of whom are in probably the most difficult situations they may be facing in their lifetime. And they do it with grace and with professionalism. So I just wanted to say that and thank the committee for your questions today. Thank you.
Thank you, Deputy. And on behalf of the members of this committee, thank you to the four of you for appearing here today. There's an enormous amount of preparatory work that goes into preparing for committee, all in addition to the very important programmatic and policy work that you do. And for sure to the service providers, but to the large staff that stands behind all of you, our most sincere thanks for their work. And you are all free to leave the meeting. Thank you. Order for committee members. We do have a couple more items. So we do have a deferred motion resulting from our last meeting. I would ask the committee if members would like to discuss this motion now. I think I'm seeing a yes. So we will begin by having MLA Hansen, who stated the motion at our last meeting, to please restate that motion.
Thank you, Madam Chair. My motion is to have the committee write a letter to the Premier's office and members of the Executive Council to urge this government to address this emergency by taking immediate action to safely house all Nova Scotians facing homelessness, by opening as many shelters and supportive housing beds as there are people sleeping outdoors. The letter should additionally urge this government to stop the flow of individuals entering into homelessness by banning winter evictions to prevent this crisis from worsening.
Thank you, MLA Hansen. Is there discussion on this motion? Seeing no, I recognize MLA Wong.
Yeah, I would just like to make a comment, really. It's from what we heard from our witnesses. I think a lot of things are changing. I do believe that our vacancy rates and stuff are, there's more and more housing. From what I'm understanding, we have a lot of good programs in place, and that people are being housed more and more adequately as things move along. So I just wanted to say that based on the expert testimony that we had today, that I think things are changing. So.
Thank you. Is there further discussion on the motion? MLA Hansen.
Thank you, Madam Chair. And I think this goes back to what the minister, the deputy minister, and the staff were saying about prevention. We haven't eradicated poverty, especially child poverty. And we are hearing now, and we could drive down the street right now and see that there are folks living in tents under a bridge. And there are folks that are living unhoused. And so my question is to create a plan and to write a letter stating that we should have a space for everyone. And we are not seeing a space for everyone. And it says as many shelter beds and supportive housing beds as there are people sleeping outdoors. So I feel like, the letter is just to write, to verify that there is action that is needed. And just even by what the presenters presented today and their expertise, that there is a lot of things that are needed. Like there's over 200 individuals right now that are homeless that are on income assistance that they can state. I think there's a lot of work that we need to do, and I think making sure that we have beds to people is just a simple thing that we could do to keep people safely out of the cold.
Thank you. MLA Macquarie.
Thank you, Madam Chair. I share, and I'm certain we all share, the sense of urgency. And we appreciate the members' efforts in making this motion. We need to acknowledge our successes while continuing to strive to do our best work to support people in need. There are some issues with the elements of the wording and the precedent that it would be setting. So I'm not going to support the motion.
Is there further discussion on the motion? Emily Hansen.
I would just like clarity on the wording that there may be issues with. I'm just curious to know what that is.
MLA Macquarie.
Yeah, sure. I think that in one sense, defining some of the goals and benchmarks that are mentioned here, while the spirit is excellent, just achieving it may not be clear. Also, while we were in the House, I'm sure everyone remembers how cold and snowy it was, and icy. And the Minister of Opportunities and Social Development assured Nova Scotians that there was a bed available for every person seeking shelter in HRM. And so I'd be happy to table that. It was stated in the House. And so the request that the letter is making has been achieved. So I don't see the point in using that letter at this point, that there was beds for every person needing shelter at that point in time. But I do wholeheartedly agree that we need to continue to strive to make things better. Because even having an emergency shelter, we can't be satisfied with that. We need to go further.
Sorry, MLA Macquarie, were you finished? I did not mean to cut you off.
No, that's okay.
And I will recognize MLA Hamid.
Thank you very much. We actually did have this very discussion with folks at Shelter Nova Scotia, and the beds available don't meet the needs of the majority of the folks that are in need of shelter. So these are folks that are in need of wraparound services, not just a bed to sleep on. And so, saying that there's a bed available for every one of the people that live on the streets it's great, but it doesn't actually support them. They can't take those beds because they have extra needs that might put others at that shelter in danger or themselves at danger when they are in those shelters. And so, again, while we can appreciate that there are beds available, that doesn't actually serve the need of the majority of folks that are on the street and in need of housing. And this is coming directly from the frontline workers of Shelter Nova Scotia. And so, again, while I don't see that there's any issue with the wording per se, because this is a letter going out to the Premier and the Executive Council, not legislation. And so I don't see that there's an issue with the letter going out. I think we can do better, and we need to recognize, when we're saying things, what they actually mean.
Is there further discussion on the motion? MLA Macquarie.
Thank you. I think the members' comments kind of highlight the deficiencies of the motion, because as there are enough beds, but some of them may not be appropriate for certain people. And so I think that's why we need to rely on the ongoing support of the department and the expertise that we have in the department. And so, I wholeheartedly support the spirit of the motion. I have confidence in the department that they will continue to strive to do the best work that they can to support people without the letter, without the motion, that this will continue. Thank you.
We are approaching the hour, and we'll soon need to call the question, but I do recognize Emily Hanson.
Thank you, Madam Chair, and I just want to be very clear. This motion has been put forward three times. This is the third time it's been put forward. Every single time it's been about wording. Now we see that the wording is just that. We are asking them to we are asking the committee, as a committee, to write a letter stating what we heard is still, there's a need. And there's nothing wrong with that. I mean, to the minister's point, there are enough beds for everyone. There are not. There are over 1,000 people on the by name list who are homeless that do not have a bed to sleep in. There are those that have acute needs that need wraparound supports, that we as a government are responsible to do that work. And I think the acknowledgement in a letter with words on it to kind of let them know that this is happening. We're hearing from experts from many different facets to let us know that this stuff is going on and we should be addressing it. And we should be at least acknowledging it. I don't see the holdup. I think, you know, when we think about the work that we do and the work that we could be doing and the work that is being done, we've heard there's more that needs to be done, and they will do the work. That's not even an issue. They have a mandate. They have things they have to do. But we as a government have a responsibility. And if we ignore it year after year after year, that this is not actually happening, then we're not doing a service to the people in Nova Scotia. This is actually what's happening right now. There are people that are under the bridge in tents. They are clearly not housed. We need to give them the opportunity to have a safe place. And in order to do that, we have to acknowledge it. And so this is what the letter's stating. It's not demanding or forcing anybody, because we don't have that as a committee to do that work. We are writing a letter to state that this is the issue, and we want to recognize it in government.
If there is no further discussion on the motion, it's time for the question. All in favor of the motion, please say aye.
Aye.
Contrary-minded? Nay. Motion is defeated. The folks from the Legislative Library have very patiently been awaiting a few moments of our time. I would welcome them now if they'd like to come to the table and the microphones to tell us how they can help to support the work of this committee. Good late morning. In my family, on April Fool's Day, you had to get people before 12 noon. So I'm just telling you all that we're approaching the witching hour. If you'd like to please introduce yourselves and proceed with your remarks.
David McDonald, I'm Legislative Librarian.
Anne Van Eiderstein, I'm Manager of Information Services with the Legislative Library.
Welcome to you both, and if you'd like to proceed with your remarks, please do.
All right. Well, thank you for entertaining our request to speak to the committee. The topic that we're interested in is the briefing package that we provide. As you may be aware, Heather Ludlow spends a fair amount of time creating these briefing packages that we hope you will use in preparing for the committee. When the library took over about 20 years ago, we started to add things that weren't in the previous committee packages that the committee office did, because they didn't have the resources and we did. So we started to include items in our collection and also references to Hansard. At one time, we even had newspaper articles, but we had to take those out. And then it was one large package. It was too big. So we changed the format in 2019 so that now you get a briefing package with a little summary of, with links 2 documents, and a little summary of why we think it's something that you might be interested in looking at for committees. So what we want to know, we're basically on an information hunting expedition here. Do you use these reports when you're preparing for committee meetings? And how do you use if you do use them, how do you use them? Are there things that we could include that you think that are missing? And is there anything that you find particularly useful with these, or if there's things that you don't find useful? And basically any other feedback that you can provide so that we can provide a better product for you.
Thank you. I will provide a moment in just a moment if there are some initial thoughts, but can I confirm that for those who might have to take this away and think more robustly about, particularly in terms of improvements, we certainly value the services that the Legislative Library provides, which up to and including finding gardening books to feed my personal passions during the recent session. And we don't want you to be spending time on pulling things together if in fact they are not being used. So appreciate that. To me, that's the spirit of efficiency within an organization to have these discussions. Are there members who have any comments at this time? MLA Hamid.
Yes, thank you very much for that. The packages are helpful to our team. They are used to do the research prior to the meetings. Now, I guess about, in terms of the time it takes you guys to put that together. I know some of the stuff is in there, stuff that we would have had, and so maybe there's discussions about, how we could save you guys time based on things that we might already have. But in terms of their use, they are most definitely used. They are most definitely used in the research prior to the meetings.
Thank you, and I am reminded by the clerk that members are welcome to provide feedback through the clerk, or feedback including any questions and comments. But very much appreciate you coming across the street to be here with us, and again for the multitude of different ways in which you support members and of the legislature and government more broadly. Thank you for that. This does conclude business for today's committee meeting. Our next meeting is slated for May 6th. Topic not quite pinned down at this time, but we will be informed by the clerk when that information is available. Do we have a motion to adjourn? Motion to adjourn. Thank you. Adjourned.